Given the strain on hospitals and EDs, we want to try to identify ways with our patients of staying safe short of going to the ED. But in the case that risk becomes unmanageable, of course the person will have to go to the hospital. It's really unfortunate because we risk exposing them to becoming ill, but if risk becomes imminent and can't be managed remotely, they need to go to the nearest emergency room or, as usual, call 911. People can come up with great ideas on their own about what can help them stay away from going to the hospital should they become suicidal. The remote safety planning process is quite similar to conducting it in person. You have to figure out how to make that work, and so that means who is going to have, how are you going to get a plan to the person, a written plan. Are they going to write it down? Are you going to write it down? Are you going to take a picture of it? So the logistics of it you have to work out with the person, and that's a little different than doing it with them in person. If they haven't done a safety plan before, you tell them a little bit about what it is, how long it's going to take. If they've done a safety plan before, it's great to just say, okay, let's take it out, take a look at it, and see, given what's going on now in terms of social isolation, what needs to be changed on it. It's really important at this particular moment to emphasize that having a safety plan is really important right now to stay safe without going to the ED or to any other kind of medical facility. And just to remind people that if they go to the ED, the resources are very limited at this point, and that it's really safer for them to stay home if at all possible. For people who already have a safety plan, we want to kind of revisit, now that this is happening, what are their new kinds of warning signs? Extreme fear of illness, which I have heard, coping with illness in self or others, like being ill and having to take care of others, feeling very lonely or socially isolated, or if you're not alone, family conflict or roommate conflict. Have people think about an emotional thermometer and to take their emotional temperature. And this is just a simple way of gauging where you are in terms of how distressed you are. And this can be used beyond being suicidal, but it can also be used for how angry, how anxious, how frustrated you are. But here we use it particularly for people controlling their suicidality. It's important to identify things that they can do when they're alone. And so we want to identify things that can be done to distract from suicidal thoughts and de-escalate the crisis. We want to make sure that whatever we're helping them choose, it doesn't increase their suicide risk, such as for some people, watching the news incessantly is going to make them much more upset. These are just some examples: taking a time out, using mindfulness apps, do an activity that will change your physical state. Use distracting activities. I've heard so many people go back to hobbies that they used to do that they haven't done in many years. Do something nice for yourself, in other words, self-soothing, and then figure out if there is a way that you can contribute virtually. So these are all things that we can do now during this crisis that we can do on our own. One of the things that we like people to do is to identify social contacts that put you in touch with other people without telling them that you're feeling suicidal. When people could go out socially, we would say, okay, is there a coffee shop that you can go to? Is there a park where there are people around that you can go to? Well, we can't do that anymore, but there's lots and lots of things online, like virtual travel tours, virtual meetup programs, virtual hangouts with friends via Skype or FaceTime. We also want to identify for the person's social environment where they are there places that they could go outside where social distancing is practiced that are safe for them to go to, that they can go to. Then you need to figure out who in this environment can help your patient if they become suicidal and they need to say, hey, I'm in trouble, I'm feeling really suicidal, or I'm in crisis now. the person that they may normally turn to might be emotionally very, very distressed right now. And so you need to do a check-in with your client about, so is the person that you usually turn to for support and help okay in this period of crisis, or do we need to kind of think about who else might be better? So for all of these things, we want to be really specific. We want to help them identify one or two key people, and we want to encourage them to share the plan with these people, to let them know that they would like to be able to use them in this way and to check it out with them. And then finally, you need to identify emergency contacts, which can be different. A lot of the people who I work with, the psychiatrists who I work with, are really not available now. They have been deployed to ICUs and medical floors, and so they are not available to their patients in the way that they had been. We need to think about who can they turn to now, and to think about virtual meeting services with healthcare professionals, or who are the stand-ins for their professional. And of course, using the hotline and text line. So we just want to make sure for all of these steps that involve contacting other people that the contact is virtual rather than in person, unless they're currently living with the person. And we just really want to underscore that with our clients. We want to just kind of let them know in advance that it might feel a little different to have virtual contact as opposed to sitting with your support person. Some people hate talking over the telephone or doing FaceTime. What you can do as a clinician is to kind of do a little bit of exposure with them to help get them a little bit more comfortable with using virtual support in a crisis. If there's time, it's great to encourage and collaborate with your patient to develop a plan to maintain stability and to build mental reserves during this time. In other words, to help them not even get into that yellow zone on the emotional thermometer. These are really simple things which you probably have seen on the internet over and over by now. Develop a daily plan and follow it. So this means, what are you going to do each day? And then in addition, within each day, have a regular schedule and try to keep to that. I know some people whose day has turned night and night has turned day already. Try to go outdoors at least once daily in a safe manner. It's important to kind of reconnect with the outside world, even if it's just standing outside your building for a little bit. Encourage acceptance of the range of feelings. And then finally, build mastery or identify and encourage pleasurable activities. This is something that we typically don't have time to do, many of us, and so you can encourage people to do this. And so the idea is building up the floor, building up the reserves as much as possible in a time of great uncertainty and fear.